My name is Kyle Huber, and this is my presentation, Guiding Growth, the Lasting Impact of Childhood Trauma and the Role of Trauma-Focused Cognitive Behavioral Therapy. A young tree grows in a forest. Its roots are shallow and its branches are frail. It is surrounded by old trees. Their roots are deep and their trunks are thick. One night, a violent storm hits. Strong winds and heavy rain batter the forest. The large trees lose some branches and develop a lean, but they endure. The young tree is bent and twisted. It continues to grow, but it has permanently changed. The young tree will have to work harder to grow, and if it doesn't find a way, it may be stunted for life. The storm has become a part of the tree and will have a lasting impact on it forever. This metaphor represents the impact of trauma. Experiencing trauma as an adult can be a challenging process, but it pales in comparison to the impact of childhood trauma, which requires a more complex and intensive therapeutic approach. The thematic apperception test, TAT, is a projective psychological test designed to reveal how someone's mind shapes their view of the world. The test is simple. Participants are shown a series of pictures and then asked to make up a story about each one. Psychiatrist, researcher, and author Bessel van der Kolk was one of the first to examine and document the effects of childhood trauma through the TAT. For the test, two groups of children aged 6 to 11 were selected and matched closely in age, race, and intelligence. The experimental group children had suffered severe forms of abuse, and the control group children had non-traumatic upbringings. The children from both groups were shown an image depicting a father fixing his car with his two kids nearby holding his tools. The children from the control group made up safe and beautiful stories about the kids helping their dad and spending quality time with him. While telling their stories, their demeanors were calm and their thoughts were organized. The children from the experimental group, however, made up very violent stories about the car crushing their father or the kids using the tools to kill him. While telling their stories, the experimental group children became overly excited and their thoughts were disorganized. The children were shown several other images, and the results were the same. The traumatized children could only imagine disastrous stories. The researchers concluded that for abused children, the whole world is filled with triggers and anything or anyone could be perceived as dangerous. This study highlighted how childhood trauma profoundly impacts how children view the world. In many cases, traumatized children expect bad things to happen continually, and this view often persists past childhood and affects an individual for their entire life. We can all acknowledge that children are super learners. For example, we regularly see them learn languages faster and with less effort than adults. Until about 12,000 years ago, humans lived in hunter-gatherer societies for hundreds of thousands of years. Life was extremely dangerous during this time, so children needed to become intelligent as quickly as possible to survive. This is the reason why children are so much better at learning than adults, because they have high neuroplasticity. Neuroplasticity is the brain's ability to perform new connections and rewire old connections. It is the reason why children learn so quickly and why their cognition and personalities can change so drastically. When an individual learns something new, brain cells called neurons build connections called synapses. The neurons use the synapses to communicate with one another. This is how the brain thinks and functions. At their peak, children can build up to 1 million new synapses per second, while the adult brain builds only about 1,000 to 10,000. Due to evolution, neuroplasticity is the highest in childhood, which is why the foundation of the brain is developed during this time. Although childhood is a time of significant brain growth, it is also when the brain is most vulnerable to trauma, due to the effect that trauma can have on the development of key biological stress systems. The hypothalamic pituitary adrenal, or HPA axis, is a stress response system made up of two brain regions, the hypothalamus and the pituitary gland, and one set of organs, the adrenal glands. All the regions work together to regulate the body's automatic or autonomic functions, social behaviors, and stress responses, mainly through the release of chemical messengers called hormones and nervous system messengers called neurotransmitters. This system's primary function is to activate the sympathetic nervous system, which is responsible for fight or flight responses that prepare the body for physical activity and stress. When the brain perceives danger or stress, the HPA axis releases hormones called cortisol and adrenaline. These hormones increase heart rate, mental alertness, energy, muscle tension, sweating, and feelings of anxiety. They serve an essential survival function because they prepare the body for danger and stress. But if this system is overactive, it can be physically and emotionally draining. The HPA axis undergoes major development during childhood. If a child is exposed to prolonged trauma during the sensitive developmental period, the HPA axis can become completely dysregulated. When a pathway in the nervous system is used over and over again, it becomes primed. Priming is an adaptation where the nervous system responds more effectively to frequent stimuli. Priming of the HPA axis in childhood is detrimental to healthy development because it makes the stress response hypersensitive. An individual with a primed HPA axis experiences huge amounts of cortisol and adrenaline in response to everyday events. The overactive HPA axis is a marker of post-traumatic stress disorder. Think of pathways in the brain and nervous system like a hiking trail. At first, there's thick, tall grass and uneven terrain, making it difficult for hikers to walk from the trailhead to the trail end. However, if the trail is used many times, the grass gets trampled and dies, and the terrain gets flatter, making hiking much easier. This is called priming. Priming allows the hiker to get to the trail end faster and with less effort. What happens during childhood trauma, however, is the path becomes far too wide and steep and turns into a dangerous mudslide. The hiker no longer has control and cannot help but fall into the path. This metaphor represents how priming is supposed to make thoughts and actions easier, but if overdone during the key developmental stage of childhood, thoughts and actions become dysregulated and out of control. As a result of the system being dysregulated, there's a chain of negative effects. At first, the increase in cortisol and adrenaline caused several imbalances of the brain chemicals or neurotransmitters responsible for behavior. The imbalance of chemicals leads to psychological disorders such as impaired decision making, disruption of information processing, and impaired reward circuits. These disorders lead to maladaptive behaviors and deficits, such as addictions, disruptive behaviors, attachment deficits, dissociation, and overall poorer cognitive and social functioning. Permanent and debilitating changes in the brain, structure, and function occur as a result of childhood trauma, and they persist into adulthood. As a nurse, it's important to understand the profound impact that trauma has on the brain, body, and mind. This is the foundation of what it means to be trauma informed. Childhood trauma distorts how children view the world and rewires the brain and nervous system to send the body into states of inappropriate, dysregulated stress. Childhood trauma isn't something that you can just get over. It's like a complex disease, and it must be treated by using an intensive therapeutic approach. The dual process theory splits the brain into two systems. System one thinking is fast, intuitive, automatic, and done with little to no conscious awareness or control. It is responsible for quick processing of information and biological responses. System two thinking is slow, analytical, controlled, and done with high awareness and effort. It is responsible for complex analyzing, problem solving, planning, and decision making. The systems are constantly competing for control over our behavior. When an individual is working through trauma, the two systems are at war. Think about someone with arachnophobia. Although their System 2 brain knows that a small spider poses no physical harm, their System 1 brain is screaming danger and activating the sympathetic nervous system's fight or flight response. A non traumatized individual has both systems working together and sharing the cognitive workload, but a traumatized individual has their System 1 brain with disproportionate control. Trauma-focused cognitive behavioral therapy, or TFCBT, is a treatment designed for children and adolescents to address post-traumatic stress disorder. This is a tool that nurses can use to help clients take control of their own behavior. The 5 key elements of TFCBT are psychoeducation, coping skills, gradual exposure, cognitive processing, and caregiver involvement. Psychoeducation aims to educate the clients about what is happening to the mind and body due to trauma. This provides the foundation for the thinking domain of CBT, giving the client the tools to predict what symptoms to expect and why they are experiencing them. Understanding the symptoms of PTSD can make the process of dealing with it less unknown and more predictable. Through psychoeducation, we are equipping the System 2 brain to better understand the System 1 brain. Coping skills aim to equip clients to identify the physical symptoms of PTSD within themselves and calm their nervous system using relaxation techniques. Coping skills provide a foundation for changing the feeling domain of CBT and connecting it to the thinking domain. Bringing PTSD symptoms into conscious awareness and then actively working to reduce their intensity can help clients control their stress response. Through teaching coping skills, we are equipping the System 2 brain to calm the System 1 brain and loosen its grip on behavior. Gradual exposure aims to slowly and systematically expose clients to trauma-related memories, situations, or stimuli in a safe and controlled environment. This allows the clients to build upon their psychoeducation and coping skills to confront and process their trauma logically instead of emotionally. This allows the brain to drastically change by shifting control from the feeling domain to the thinking domain of CBT. Through gradual exposure, we are giving the System 2 brain control in a situation where the System 1 brain would usually have control, which helps build the pathway for the System 2 brain to take control in the future. Cognitive processing is the core of cognitive behavioral therapy. This is a highly logical process of the thinking domain, where illogical thoughts and beliefs about a traumatic event are broken down and challenged, and then replaced with more accurate and adaptive logical thoughts and beliefs. Through changing how clients think about their trauma, they eventually change how they feel about it. Through cognitive processing, we are giving the System 2 brain the tools to make the System 1 brain less powerful. Caregiver participation is a key difference in dealing with childhood trauma versus adult trauma. Cognitive behavioral therapy is an advanced client skill, and it takes constant practice to master. Children do not yet have the intellectual or emotional foundation to go through TF-CBT alone, and so an adult caregiver is vital in guiding them through the healing process. Through caregiver participation, the caregiver is using their System 2 brain in collaboration with the client's System 2 brain to combat the control of this client's System 1 brain, ultimately giving the client control over their thinking, feeling, and behavior. Continuing with the metaphor from the beginning, though the young tree may be warped, it is not beyond hope. Forest rangers come into the forest and provide scaffolding to help the young tree grow straight. The young tree has to work hard to get the sunlight and nutrients it needs, but it eventually establishes deep roots and grows strong. Just like the young tree, children affected by trauma can find resilience and growth through the right therapeutic interventions. Trauma-focused cognitive behavioral therapy is the scaffolding that can guide them, helping them understand and manage their stress responses, reshape their perceptions, and build healthier cognitive and emotional foundations. By acknowledging the profound impact of childhood trauma and employing intensive therapeutic approaches, we can help children with trauma not only survive, but thrive.